And this group is a nonprofit organization that's focused on providing healthcare and information to different communities in Guatemala. Overall, their main goal is to generate a positive change related just overall to the quality of life of the people that live in these rural communities. They serve 10 different communities, which you can see on the map in the different colors. This is in an area called the Palahuna Valley, which again is in Guatemala, and it's right outside of that city, Quetzaltenango. They chose Guatemala specifically because it is one of the most impoverished countries in Latin America. They have the sixth highest malnutrition rate in the world. 2/3 of the population lives on less than $2 a day, and 54% of families show signs of chronic illness. In these peripheral communities, 97% of people said it would take almost 1 hour to reach an area with a physician, and 35% of the Palahuna Valley population could not afford this necessary transportation if they needed medical help. So basically, this organization supplies things like medical, dental, and nutritional care to improve the lives of these people. They also do things like providing clean water and food for the malnourished children that live there. And the organization is made up of health professionals, so like doctors and dentists and assistants for them, volunteers, and Guatemalan community leaders.
Okay, so Primeros Pasos currently is the only clinic open in the valley with a medical doctor, dentist, and licensed nutritionist. But because of COVID, rural health posts are less stable, so they're often closing unexpectedly due to possible exposures, lack of supplies, or PPE. But still, Primeros Pasos is still the only clinic that's open. Though before reopening the clinic in March, the team supported short-staffed primary schools in distributing food staples to families in need. They still are able to keep up with their current forms of care for people in the community. Like, for example, Tierra Colorada Alta is one of the more distant communities in the valley that do not have access to running water in their community, and so they don't have piped water or a well. And so before COVID, Primeros Pasos would normally purchase non-potable water from a truck that visits the community weekly, but the water truck became unreliable, and members were becoming concerned with having enough water since preventative hand washing has become one of the biggest preventative methods for COVID. And so Primeros Pasos' response to this was to get donations in order to directly donate water containers to each of the 85 families in the community instead.